Good morning. Hello, everyone. Welcome to the College of Nursing's 2024 Spring White Coat Ceremony. I am Danny Willis. I am the new Dean and Professor of the College of Nursing, and it is my privilege to serve in this capacity. Thank you all very much for being here, especially the family, the parents, and friends, and special guests who are here with us today for this very special occasion. The White Coat Ceremony is a tradition for which you will hear more about from our Associate Dean, Dr. Susan DeSanto Medea. It symbolizes a pivotal point in one's career for all the students before us. I'd like to take a moment and reflect with the students on this pinnacle event. For you, this is a passage as a student into the nursing profession, the most noble profession, the most trusted profession. It marks your entry into caring for the lives of others that depend on your honed knowledge and skill and a vast array of aptitudes. For the faculty and myself, it is a launching of a cohort of white coats to join us in the being entrusted to provide nursing care for others, often during the most vulnerable times in their lives, which you will hear more about today. Momentarily, you will hear about the tradition of the white coat. But before we get to that, let me start by saying congratulations, number one, for reaching this exciting milestone in your career. Join me, audience, in a round of applause for this distinguished group of future nurses. You have worked hard. Just think, chemistry is behind you. And you now have the scientific knowledge to begin advanced nursing knowledge courses and clinical experiential learning. In this transition, you are bound by the same professional commitments that bind all nurses. This includes the American Nurses Association Code of Ethics, which we all hold dear and being absolutely critical for our practice. This code is a fundamental document by the American Nurses Association. It provides a social contract that we make with society. It is your professional obligation to uphold this code now, today, and as you go forward throughout the rest of your career. The Code of Ethics for Nurses is the promise that we nurses are doing our very best to provide care for our patients in our communities and are supporting each other in this process so that all nurses can fulfill their ethical, moral, professional obligations. The historical roots of the code stem from the Nightingale Pledge, introduced in the mid-1800s. The code was revised to reflect both societal changes and advances in healthcare. This code is foundational, as I've said, and it's essential for us to do our jobs well and to maintain the trust of the public who we serve. At this time, I'd like to remind you of these 9 provisions from the Code of Ethics. As I do, let's take a moment to reflect on them, and let's think about your duty to uphold each and every one of them. The first principle: the nurse practices with compassion and respect for the inherent dignity, worth, and the unique attributes of every person. Number 2, the nurse's primary commitment is to the patient, and you'll hear more about this later, whether an individual, family, group, community, or population. Number 3, the nurse promotes, advocates for, and protects the rights, health, safety of the patient. Number 4, the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes actions consistent with the obligation to promote health and to provide optimal care. The nurse owes the same duties to self, really important to hear this, as to others, including the responsibility to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. The nurse, through individual and collective effort, maintains and improves the ethical environment of the work setting and conditions of employment conducive to safe, quality health care. That was number 6. Number 7, the nurse in all roles, in all settings, advances the profession through research and scholarly inquiry, professional standards development, and the generation of both nursing and health policy. Number 8, the nurse collaborates with other health professionals and the public to protect human rights, to promote health diplomacy, and to reduce health disparities. Number 9, the profession of nursing, collectively through its professional organizations, must articulate nursing values, maintain integrity of the profession, and integrate principles of social justice into nursing and health policy. Lot there. Really great things. So as you move forward in your career, be informed and be inspired by this code, as well as those who have gone before you. Be aroused to be an agent of change, an advocate to improve the well-being of others. So now I would like to introduce you to our Associate Dean, Dr. Susan DeSanto Medea, who will bring greetings and a history of the white coat ceremony tradition. Thank you.
Thank you, Dean Willis, and congratulations to all the students on this milestone in your career, and congratulations to all the families that are here, whether you're blood family or just a friend, neighbor, and of course, congratulations to our faculty who have helped to launch you on your career. So I am happy to discuss the white coat ceremony with you today and give you a little bit of the history of how this all began. So the white coat ceremony is the milestone in your nursing education. The white coat represents the demarcation between your preclinical coursework and the phase of your education now entering into clinical practice, where you will be working with patients and their families or in the community and with the population. It demonstrates your growing knowledge of evolving expertise. It stands as a symbol that distinguishes you as a member of the patient care team and as a member of that team. It represents the trust that patients and their families will have in each and every one of you. The first white coat ceremony was established in 1993 at Columbia University for the College of Physicians and Surgeons through the vision of Dr. Arnold P. Gold. He believed that medical students should be given well-defined guidelines regarding the expectations and responsibilities of their practice and the medical profession prior to their first day of education and training. He believed the declaration of commitment to the tenets of the medical profession should be taken at the start of education and not at the end. Since that time, his vision has expanded to include various medical professions, and in 2014, through the partnership of the Arnold P. Gold Foundation and the American Association of Colleges of Nursing, support was offered to establish white coat ceremonies for nurses. What started as a formal commitment to a profession has evolved to an overarching commitment to healthcare. As stated by the Arnold P. Gold Foundation, that healthcare professionals in training and in practice must embody a culture of respect, dignity, and compassion for patients and professionals. When skilled practitioners build caring, trusting, and collaborative relationships with patients and each other, the result is better care decisions and better health outcomes. So marking this occasion of your readiness for clinical education should also carry a reflective moment of your commitment to the practice, values, and ethical standards we as nurses have to our patients, their families, and the patient care teams. It is your public declaration that you will always prepare yourself through study and training to provide knowledgeable care and ready yourself to always uphold human dignity in all aspects of your practice. Congratulations and welcome again to the white coat ceremony. I will now turn it over to Dean Willis again.
Thank you, Dr. DeSanta Medea, for that synopsis that lays the foundation for this event going forward. I would like to introduce you to the College of Nursing faculty. These individuals are joining you on this journey over the next couple of years to become a professional registered nurse, and we have them congregated here in the front, so I would ask you to rise, please. These faculty members and others who are not here are an exceptionally talented group of scholars who are committed to the learning of each and every one of you. They are responsible for shaping the profession of nursing nationally, also here regionally, and around the globe with their contributions to developing nursing science, nursing theory, practice, and policy. But in addition to these areas of expertise, they are formidable teachers, mentors, and role models who will take a special interest in helping you develop into a successful professional. One of the things that's really outstanding about this School of Nursing is a very hands-on approach to your professional development. You're not just a number to any of us. You are a person who is on a professional journey. So please seek out their wisdom, as they have much to offer you, and you have much to offer them. It is now my pleasure to introduce our distinguished guest speaker, Dr. Elaine Meyer. She will be speaking for today's ceremony. She is a child and adolescent psychiatric nurse, clinical psychologist, and an ethicist. So look at all the opportunities, folks. She is a senior attending psychologist at Boston Children's Hospital, faculty at the Center for Bioethics, and associate professor of psychology at Harvard Medical School. She received her BSN and her MSN from the University of Pennsylvania, PhD from the University of Rhode Island, go Rhody, and an MBE from Harvard Medical School. That's a master's in bioethics. Her work emphasizes patient and family care perspectives and priorities, end-of-life care, challenging conversations in healthcare, which we know that we always have to have those, and it takes a lot of courage, and simulation education. Ethics interests focus on everyday ethical encounters, virtue ethics, patient advocacy, serving vulnerable populations, and humanism in healthcare. She is a fellow of the Society for Simulation in Healthcare and an associate editor of Simulation in Healthcare, and has delivered a TEDx talk entitled On Being Present, Not Perfect. Love that. She consults and she presents nationally and internationally and has over 150 peer-reviewed articles and chapters behind her work. So we are thrilled to have such a distinguished guest with us today. Please welcome Dr. Elaine Meyer.
Thank you very much. I hope that I can live up to that. Can everyone hear me? Okay, great. Well, thank you so much for being here. It really is my honor. And I'd like to welcome, really a hearty welcome to all of you, students. Seeing you here, it's wonderful to see you as a group. Thank you. Parents and family, faculty, university personnel, and also community members that are here. Thank you so much, and welcome to you. I want to thank the faculty for really entrusting me with this address and with this invitation. I take it very seriously, so thank you very much. So students, this is a very big day. It's a big occasion, and it really is our pleasure to celebrate with you and to honor you today. For all of your hard work, for your achievements, and your dedication. So today's white coat ceremony really does represent a big milestone for you. It's a rite of passage, as Dean Willis has said. Now today you're going to be crossing that threshold. You're going to, in a sense, walk through that archway from classroom studies to caring for real patients. And when you don that white coat that you have in your laps right now, I really do hope that you stand a little bit taller and a little bit more confident knowing that you are well on your way to becoming a nurse, to joining our noble profession, and we hope you are as proud of yourselves as we are of you today. So thank you. So what lies ahead? Most of us enter nursing school because we want to make a difference in the lives of other people. We want to care for those who are ill, who are suffering, and those who are in need. Essentially, we really do want to make a difference in this world, and that's what we're called upon. That's what draws us oftentimes initially to nursing. And I'm here to tell you that with this ceremony, you are one step closer to becoming a nurse today. And you will be called upon to put your knowledge and your skills to use, to make decisions, and to deliver care for vulnerable people who need you, and they depend on you. So it's a big responsibility. Now, as exciting as all of this might be, you might be saying and wondering, am I ready for all of this? Okay, it sounds heavy, it is, but I'm here to tell you, if you are invited to today's ceremony and sitting there with your white coat on your lap, it means that the faculty trusts that you are ready for this next step. And I'm also here to tell you that uncertainty about am I ready is pretty common. I know that I certainly had it. I surely had my doubts at this moment in my career, but I think I turned out okay, and I have a lot of confidence that you will too. And I want to just remind you that you, actually every single one of us in this room, not just the nursing students, are a work in progress. We're constantly evolving and changing. So remember that, you're a work in progress, and always remember also that practice makes better, okay? You don't have to have it all figured out, but that open-mindedness to figure it out is really what counts. So what I'd like to do is share a story with you, and this is a story from my own nursing experience as I was a nursing student in my pediatric rotation. And my young patient, his name was Addison, we'll call him Addison, had cystic fibrosis. And this was the first time that I had ever seen or been with a person who had cystic fibrosis. And it felt pretty daunting because all of a sudden I've never been with a person with cystic fibrosis, and now I'm supposed to be providing care for someone with cystic fibrosis. Okay? I definitely felt in over my head. I completed my nursing assessment and took care and did my nursing care. Addison had all of his respiratory therapy and his medications, and he went to the playroom. I remember this very distinctly, and he played with Legos, and he liked building battleships. And it wasn't lost on me that his building those battleships was really sort of a reflection of that fight, that war that he was in, if you will, with cystic fibrosis, that he was waging against cystic fibrosis. And he grew tired that day, and he finally settled down for a nap. And I was so grateful that he had had a good day that day. And as the new nursing student, I thought to myself, he had a good day, I had a good day, okay? And I just took a breath, and I felt content at that moment. That was until his mother asked me the question. It was a simple question, and what she asked me was, can we talk? My first thought was, about what? Because I got to be honest with you, I didn't feel like I really knew very much or that I had that much to offer. But I have to tell you, I had the good sense at that moment to sit down and to listen. And that's really when things changed and shifted. And I wasn't sure about what to say and do, but sitting down and listening was, I think, the right thing to do. And Addison's mother went on to share her hopes and her dreams for her little boy. Now, she was very worried about him getting sicker. She was worried that he needed to be hospitalized more often, that the medications weren't working and they weren't working as effectively. Of course, she hoped for a cure for cystic fibrosis, but she also hoped for smaller things, more doable things, like she hoped that his friends would continue to invite him to play dates and to birthday parties so that he could be a regular kid and have friendships. And I was struck at that moment, as a nursing student, of the importance of listening to our patients, of validating their stories and their experiences. And it can really mean the world to be listened to and to be known, especially when you're ill or suffering or vulnerable. And that day, I learned that my humanity was my greatest gift, and that I was called upon to be present, not perfect. So that TED Talk actually came from a day in my pediatric rotation as a nursing student, and it stayed with me all these years. So what I'd like to do now is to share an approach, a kind of a philosophy that I've turned to and that I've come up with that has helped me in my career. It served me well, and I hope that it can guide you as well. It's called the Wizard of Oz approach, okay? I just do want to ask you, how many of you are familiar with the Wizard of Oz story? Oh, thank goodness, because I was a little nervous that some people might not have heard of it, but that I'm dating myself. So good. So we're going to talk a little bit about how the Wizard of Oz can serve you, okay? And maybe everyone in this room to some extent. So the classic Wizard of Oz story reminds us that there are 3 essential ingredients that are important to cultivate in life and as a healthcare professional: courage, brains, and heart. So let's take a look at each one of these. Now, it was the lion who went to Oz for courage. So when it comes to courage, Dean Willis said that you're going to need this in your career. And there will be times, I'm here to tell you, in your nursing career, that you will be called upon to summon your courage, when it is important to speak up on behalf of your patients and to express concerns when things do not seem right. Hone your moral compass as your North Star to guide your actions. And always remember to exercise integrity and to be trustworthy. Aspire to be a voice and an advocate on behalf of your patients. Don't be merely an echo. Aspire to be a voice for your patients. So Aristotle, okay, the Greek philosopher from a very long time ago, taught us this. He said, courage is the mother of all the virtues, because without it, you cannot consistently perform the others. And Martin Luther King Jr., who we honored this week, taught us this. Never, never be afraid to do what's right, especially if the well-being of a person or an animal is at stake. Societal punishments are small compared to the wounds that we inflict on our soul when we look the other way. So we have Martin Luther King Jr. to thank for that guidance. And John Wayne, many of you in the audience, I think, probably remember John Wayne. He was an actor who was in a lot of cowboy and movies. Basically, what he said was, courage is being scared to death and saddling up anyway. Okay, there will be times that it feels like that. Now, the scarecrow went to Oz in search of brains. And brains is that ingredient of applying your nursing knowledge, your lessons in anatomy and physiology, your careful history taking and assessment. And brains has to do with mastering and applying our nursing science and our skill set to the fullest, of being conscientious when rendering the best care possible. Another bit of advice I would give to you is never to cut corners. It will always come back to haunt you, and it can make the difference between good nursing care and excellent nursing care. And the Tin Man, we remember what he went to Oz for? He went for heart. And now this essential ingredient of heart in nursing practice, it has to do with imagining the patient's perspective and showing compassion, mercy, kindness. Heart in healthcare means honoring the dignity of each person. And you can accomplish this through your careful listening, your calm presence at the bedside, your touch, your kindness. And remember that every person is equally deserving of dignity. Being humble, not stereotyping or standing in judgment of others, this can help us to cultivate healthcare with heart. And if you want to learn a little bit more about that, the Wizard of Oz, I did tell this story as well on the TED Talk if it ever helps you, just to remind you about what this means, and hopefully it'll help to guide you a little bit. So in terms of some advice, although you are new and you may be the least experienced, always remember that you are part of a team and that you are worthy and have a contribution to make to the care and well-being of your patients. Cultivate that balance between courage, brains, and heart, because you will need all three of those ingredients. And having a good balance makes the difference between a good nurse and a great nurse. What I'd like to do now is to share with you a quick story about a young nurse who was new to the profession, and to illustrate the capacity that she brought, the ingenuity, and the power of one young nurse. I was teaching a workshop around difficult conversations in healthcare in the neonatal intensive care unit, and there was a senior neonatologist physician who kept expressing his frustration about parents who continued to smoke. Okay? These are parents who had premature babies, many of them with extended hospitalizations. And he kept warning them over and over again, smoking can be dangerous to the baby's health. But honestly, the parents ignored his advice. They were not listening to him, and he was growing more and more frustrated. And I remember in that group of learners, there was a young nurse. And she raised her hand, and she said, well, I've experienced some of this. And then she went on to share that the parents would go outside to smoke, and then they would come into the neonatal intensive care unit and they would want to hold their baby. So this is what she did. One nurse, one young nurse, okay? She helped each parent when they came back into the unit to wash their hands, and then she settled them into a rocking chair, she said. She placed a clean blanket on the parent's shoulder and chest, okay, as she settled them into the chair. And while she did this, she explained that that blanket would help to protect the baby from the smell and the residue of the smoke. Now, she got the parents' attention when she did this. And they looked up, kind of incredulous, as though it was the first time, and they said, "You mean the smoke could really hurt the baby?" And with that, that nurse had reached the parent in a way that no doctor who was saying smoking is bad for the baby's health was going to be able to do, okay? And she did this without shaming, and she did it without lecturing. And she had also acted on behalf of her little patients, the babies. And she had essentially advanced their well-being through this. So what I say to you, to the young nurses getting started today, the students, never, ever underestimate your capacity, your creativity to make meaningful differences in the lives of your patients. Now, Dean Willis mentioned this earlier, caring for yourself, and that really is essential. We sort of give lip service to it sometimes, but let's just take a moment to unpack that. It really is vital to take good care of ourselves. Now, this can be easier said than done. Remember the basics, okay? Eat good food, make sure you get enough sleep. I've heard that 100 times. You will be entering patients' lives at their most stressful and vulnerable times. To bear witness to this day in and day out, it can take a toll. And it's important to cultivate a balance in your own lives. Having some life-affirming hobbies, endeavors, can really make a big difference. Think about what brings you joy and feeds your own soul. For me, it's nature, my faith. I like to grow herbs. I cook with my family. I have a dog. Whatever it is for you, music, art, photography, dance, animals, whatever it is, try to keep these things in your life to replenish yourselves, okay? Now, parents and family members, grandparents that are in the audience, I think this is where you might also be able to lend a little bit of help with your understanding and your offering of support. Nursing school is hard. It's challenging, okay? And through your listening, checking in, it could be a pat on the back, a hug, a good meal, a care package. Your students will appreciate your efforts, however small. So thank you for helping them on this journey. So at this point, what I'd like to say to the students is, Your white coats and your patients are ready, okay? They're waiting for you, okay? And we're so proud of you today, and we stand ready to support you. Remember, the white coat carries great symbolism, but it is the person who wears the coat who makes all the difference. So I ask you and I encourage you to be wholehearted in your efforts and learn all that you can from this incredible faculty that's here to serve you, from your faculty members and your patients who are likely to be your greatest teachers of all. And as the Quaker proverb teaches us, let your lives speak. Thank you.
Wow. Thank you, Dr. Meyer, for that very authentic and real and inspiring message to our white coat students today and to the audience. So it is now my pleasure to introduce Dr. Jay Lee, Assistant Professor in the School of Nursing, who will deliver the faculty welcome. Professor Lee is one of the nursing faculty who will have you this semester. And she will be teaching you pathophysiology, which is Nursing 2013. So thank you, Dr. Lee, and we look forward to hearing from you.
Hello and welcome, class 2026. And as the Dean Willis introduced me, I'm Jay Lee, and I will be teaching pathophysiology this semester, and cannot wait to meet and work each and every one of you. Congratulations again on being admitted to the College of Nursing. This is a significant achievement. Choosing a nursing degree is an excellent decision, as nurses are essential and vital components of the healthcare system. I am so proud every time I hear heartwarming stories about nurses making a real difference. As you heard a few times today, our faculty is here to support you throughout your journey. We understand that your sophomore year can present challenges with several exams and assignments as you are taking multiple classes per semester. My advice to you is not to hesitate to seek guidance when you face challenges and difficulties. We are here for you. Your success as nurse professionals and scientists is our top priority. Take advantage of the welcoming URI community. As sophomores, you will build scientific foundations and develop the professional ethos needed to excellent nursing care. You will explore specialized areas like oncology nursing, geriatrics, telehealth, psychiatric nursing, to name a few. These next few years are an opportunity to excel, and we are here to help you make the most of it. So best of luck in your first semester as a nursing student, and I will see you next Wednesday at 2 p.m. sharp. Thank you.
Thank you, Dr. Lee, and I know she's going to be excited, and you will be too, to be together on Wednesday. That's quite awesome. So we will now begin the presentation of the coats and the ritual with that. Dr. DeSanto Medea, please come to the podium to announce the candidates for the white coats, and Dr. Lee and I will present the coats to our worthy student candidates, and students will cross the stage.
They should be coming up, I think. They bring a card. You should be after, because Jay should put the jacket on, and then you should congratulate. Very exciting moment. I know we're all anticipating this, so. Ready, Kayla? Kayla Alexander. Amanda Belkunas. Rachel Berry. Camden Benedon. Issa Bible. Olivia Calderon. Sarah Capuano. Hannah Clark. Megan Coan. Isabel Conan. Samantha Connors. Haley Crow. Via De Silva. Ashley DeSuze. Cadence Devlin. Max Ebschutz. Emma Ford. Kayla Fermiglio. Brenna Gambardella. Abigail Jaya. Ali Goglia. Katie Hoffman. Radhya Janudi. Mally Younger. Alexandra Kelly. Elena Kilpatrick. Maddie Ligori. Sienda Liscombe. Julia Luciani. Emma Lusick. Alice Marangi. Ivanka Marusak. Chloe Mearn. Lily Meisterich. Marlon Severino. Vanessa Morrison. Natalie? I don't know. One moment, please. Catherine Orr. Javelin Montero. Natalie Moulton. Julia Neubauer. Alexander Nong. Sydney Pak. Sierra Panny. Julia Perry. Genesis Phillips. Madison Powers. Olivia Powers. Dominique Salazar. Julie Salco. Myalata Schmidt. Madeline St. Peter. Ashley Thurston. Christina Vitina. Michaela Vocalari. Thank you all, and congratulations to their students, our parents, and our faculty.
Okay, big round of applause again. And can all the families, friends, loved ones of the students stand for applause? Thank you for your care and support for these students. So now we come to the point in the program with the reciting of the oath, and the slides have been changed, and you can see this behind you. And students, you will find the student nurse oath on the back side of today's program. Students, or shall I say white coats, will you please rise and face your family, friends, and special guests? Please raise your right hand and repeat after me as we recite the student nurse oath. On three. 1, 2, 3. As a nurse dedicated to providing the highest quality and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns. Act in a compassionate and trustworthy manner in all aspects of my care. Apply my knowledge, experience, and skills to the best of my abilities to assure optimal outcomes for my patients. exercise sound professional judgment while abiding by legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and the responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility with which I am entrusted by the public. Okay, on to the next phase, right? Will the audience please join me in welcoming this esteemed group of students into the next phase of their preparation towards becoming a professional registered nurse. Congratulations. One more round of applause. So we come to the closing, and again, I want to say a special thank you for our esteemed guest, Dr. Meyer, for your inspiring, authentic, and real delivery of what I think are the most important things for a nurse to hear. I really love that you brought forth a message of being present, not perfect, in the process that these individuals are on in terms of their journey. So thank you. Thank you, faculty. You are here to be their guides and their mentors and help to launch this next group into the profession. A special thanks to Assistant Dean Jess Beauclair in the back of the room, and to the College of Nursing staff who are spread throughout, but please stand, staff, please. These important events could not happen without the work of a lot of people. Thank you, family and friends, for taking time out of your busy schedules and days to celebrate this significant occasion. We're so happy that you're here. And finally, congratulations, students, once again. Welcome to a fabulous and rewarding career in nursing. And now, we're concluded with our ceremony, but I would like for the students to please remain here in the front of the room, and I believe that we're going to try to orchestrate a group photo. So thank you again. Have a great day.